Today, I'd like to discuss an important health topic, vitamin B12 deficiency, particularly in strict vegetarians, and its potential link to an increased risk of stroke. I was prompted to explore this topic after a personal experience. A friend's father, a devout Buddhist who spent years practicing strict vegetarianism at a temple, passed away from a stroke. He was a non-smoker, abstained from alcohol, and had no issues with high blood sugar or blood pressure, common risk factors for vascular diseases. This made me wonder what could have caused his stroke. It wasn't until I stumbled upon research articles that I connected the dots. Keywords like strict vegetarianism, hyperhomocysteinemia, and vitamin B12 deficiency stood out. Suddenly, it all started to make sense. In a 2006 case report, researchers shared findings about two young, strict vegetarians with no known vascular risk factors. One suffered a left middle cerebral artery infarction, and the other had bilateral, multiple cerebellar infarctions. Further investigations revealed moderately elevated homocysteine levels and low vitamin B12 in their blood. High homocysteine is a recognized independent risk factor for vascular diseases, associated with both major and small vessel ischemic stroke. The researchers concluded that long-term strict vegetarianism leading to vitamin B12 deficiency might be an underlying cause. A 2015 article in the American Journal of Preventive Medicine raised the question, is vitamin B12 deficiency a cardiovascular risk factor for vegetarians? The article noted that for every 5 moles/L increase in homocysteine levels above 10 moles/L, the risk of circulatory health issues increased by 20%. Despite vegetarians generally having better traditional cardiovascular risk factors, like lipid profiles, blood pressure, blood glucose concentrations, and body weight, their rate of heart disease did not show a significant advantage compared to non-vegetarians. The authors suggested that vitamin B12 deficiency in vegetarians might negate the cardiovascular benefits of their diet. In 2019, the BMJ published a similar article. Researchers conducted an 18-year follow-up study on meat eaters, fish eaters, and vegetarians to understand the impact of these diets on the risk of ischemic heart disease and stroke. They observed that fish eaters and vegetarians had a lower incidence of ischemic heart disease than meat eaters, but vegetarians had a slightly higher risk of stroke. The authors speculated that this could be due to low levels of LDL cholesterol leading to an increased risk of hemorrhagic stroke and potential deficiencies in nutrients like vitamin B12, vitamin D, essential amino acids, and omega-3 fatty acids. So, what does all this mean? It's clear that vegetarians, especially those who are long-term and strict, face the risk of vitamin B12 deficiency if they do not supplement their diet adequately. Stroke is just one of the severe complications that can arise from this deficiency. Moreover, the body doesn't provide specific early warning signs of vitamin B12 deficiency, meaning it's easy to miss the initial red flags. For vegetarians, those with low dietary intake of vitamin B12, or individuals with methylation issues that prevent the conversion of regular vitamin B12 to its active form, it's wise to get tested for deficiency if financially feasible. Let me briefly explain 4 testing methods and their pros and cons. Serum B12 levels. This is a common test known to most doctors. Normal values typically range from 180 to 914 pg/milliliter. Below 180 is often considered deficient. 180 to 300 is borderline. Above 300 is usually normal. Over 900 could indicate liver or kidney issues or blood disorders. Some studies have found that high B12 levels might be linked to an increased risk of liver or pancreatic cancer. While it's rare for B12 to be toxic, as it's a water-soluble vitamin and excess amounts are usually excreted, rare doesn't mean non-existent. Methylmalonic acid, MMA. This test is useful when dietary habits and medical history suggest a potential deficiency, but it's not confirmed by the first test. MMA levels rise when vitamin B12 is deficient, as it's crucial for certain metabolic reactions. This test is sensitive and can detect elevated levels before significant symptoms appear. Homocysteine levels, often conducted alongside the MMA test. High homocysteine levels can damage vascular endothelial cells and contribute to atherosclerosis, leading to increased risk of cardiovascular diseases. Elevated levels might indicate early or mild B12 deficiency if vitamin B12 levels are slightly decreased or normal. If only homocysteine is elevated, it could be due to folate deficiency. Mean corpuscular volume, MCV, part of a standard blood test. MCV indicates the size of red blood cells. B12 deficiency can lead to abnormally large red blood cells, a condition called macrocytic anemia, indicated by an MCV above 100. However, this is not a highly sensitive marker for B12 deficiency. In conclusion, vegetarians, particularly those who follow a strict plant-based diet, are at risk of vitamin B12 deficiency and its associated complications. Regular testing and awareness of your body's B12 levels are crucial. Since vitamin B12 is primarily found in animal products, vegetarians should consider supplementing, preferably with more bioavailable forms like methylcobalamin and adenosylcobalamin, under professional guidance. Thank you for your attention to this important health topic. Remember, awareness and proactive health measures can make a significant difference in your well-being.